Why do you think women's health has been neglected in healthcare policy, funding and research? Why have we been left out?
I think we were on the too hard pile for a long, long time, weren't we? We didn't use women in clinical trials for medication until it's only been in about the last 20 years, isn't it? That's actually been allowed because we were too complicated because of our hormones. And so we studied things on men because then they didn't have the fluctuations that we have, but therefore we don't have the results that we can tailor to women. So I think a lot of it is women were seen as complicated, a little bit difficult. And if we go back to our sort of very traditionalist roles, not a priority. And we weren't in the workforce. We didn't have as much of a voice.
Yeah.
There was all of these things going on. And I think that all those small factors pull them all together and you actually end up gagging us as women. We are light years behind where we should be.
They've never been the default, have they? We've always been the other. When it comes to research, clinical trials, diagnostic data, it's always been based on the male body. As Tracey said, women have been considered to be too complex or too hormonal to be included. And as a result, we're getting, areas that are completely under researched, that we're getting delays in diagnosis, and we've got like health systems which are basically based on completely the wrong model as a result. So we're just catching up from decades of systemic exclusion.
Yeah.
Women's health, menstruation, menopause, fertility, it's really out there and it's really trending. So we are really behind, and there are some basic things that we don't know. So things like medications, they were all trialed on men and we don't respond the same way. So there are things that we really have to catch up on. And I think maybe some of you know things like heart attacks. Women don't have heart attacks in the same way as a man has a heart attack. And that has definitely caused problems in the past. Well, women get more osteoporosis, women get more dementia and Alzheimer's. These are things that we need to research into. And we must really be careful about how we've extrapolated things from a man to a woman. Women are not little men, smaller men. We have very, very different biology, different genetics. We can just put everything that we've developed for a man, we'll just move it over to a woman. And we can't do that. Even things like doses of drugs.
Yeah.
We are smaller than men, but we're not small men. But we have to be really careful. All the drugs, it gives you one dose of everything.
Yeah.
And we really need to do that more on weight and on gender as well. So, but it is our time. It's happening. It's things like, woohoo!